It's time for the tense and nail-biting part of this morning's ceremony, the announcement of the APNA Nurse Awards. I'd like to, Deb will stay on stage to help wrangle the awards, and I'd like to invite Karen back to the stage to present the awards. Thank you.
Thank you, Deb, for that very empowering speech, and thank you, Jean, for the introduction. Okay, so we'll now move on to the APNA Awards. It's with great privilege that I'm here to announce the APNA Awards for 2018. It's a time for recognising the effort put in by primary healthcare nurses and acknowledging exceptional achievements in the field. We are delighted to present the awards to outstanding nurses in their fields to recognise and acknowledge the hard work they do. This year saw a range of very high quality nominations from across the country, with finalists epitomising remarkable contributions nurses make to their communities. The nominees are independently assessed by a panel who report back that it was extremely difficult to choose winners from such a fantastic group of applications. We know that many of our finalists have gone on to do amazing things, our past finalists, and you'll see some of those friendly faces around here today. We have Robbie Redbrook, who will be speaking later in the program, and we also have Kim Poyner, who some of you met at workshops yesterday on chronic disease managing and health coaching. It's exciting and heartening to see the winners of our awards engage with APNA and to continue to advocate for and educate primary healthcare nurses. The APNA Awards include the APNA Recently Graduated Nurse of the Year and the APNA Nurse of the Year. The APNA Awards recognise nurses working in primary healthcare who have excelled in their local communities in the past year, and the awards are a showcase, a platform to showcase some of this outstanding work. The first award to be presented is the APNA Recently Graduated Nurse of the Year. A bit about this award: the winner of this category is a recently graduated nurse who has also recently entered primary healthcare and has excelled in one or more of the following areas over the past 12 months. The winner of this award demonstrates leadership and excellence in the field of primary healthcare nursing, inspires other nurses and other health professionals, provides a voice and advocates on behalf of nurses in their community, and they contribute to improving health outcomes for patients. The APNA Nurse of the Year, about this award, the award goes to a nurse who's excelled in one or more of the following fields, demonstrating leadership and excellence in the field of primary healthcare nursing, inspiring other nurses and health professionals, providing a voice and advocating, contributing to improving outcomes in their local community, and contributing to their field by putting back into primary healthcare setting to benefit others. Now, I would like to invite Rosemary Bryant to the stage. Rosemary and Deb will be handing out the awards to our very lucky winners. Rosemary Bryant, the third award category is the Rosemary Bryant Award, and Rosemary Bryant is a respected leader and distinguished figure in nursing. Many of you know Rosemary personally. She's held prestigious positions such as Australia's first Commonwealth Chief Nurse and Midwifery Officer. She's been the 26th President of the International Nurses Council, nicknamed Chief of the World, I think. Yes, Chief of the World. She's Chief Nurse of the World, but we really know Chief of the World. And she continues consulting with the World Health Organisation. In June 2014, Rosemary was made an Officer of the Order of Australia, And in 2015, when Rosemary stepped down from the chief nurse position, we nabbed her before anybody else could to ask her to be the patron of APNA. To acknowledge the significant long-term achievements and contribution of Rosemary has made to the nursing profession, we have named our prestigious award in her honour. I think we'll get ready to... So we will start with our first awards. So I will give you a little bit background to each person. We have a finalist and then the award winner. The first award is to be presented for the APNA Recently Graduated Nurse of the Year, and the finalist for this award is Kerry Lee McBride. Kerry is known to take initiative in identifying areas that need improvement within her practice, whether that be modifying childhood vaccination procedures, rearranging equipment to enhance the flow, and registering patients for the My Health record. She's proactive in self-improvement and has initiated monthly team meetings to encourage ongoing learning amongst staff and share experiences. She advocates for her patients. She makes sure that new patients first and identify eligible candidates for health assessments. Her initiative and drive are standout factors for our assessors, and Kerry frequently consults with patients who attend for routine vaccinations in order to identify any developmental issues and concerns for parents. Congratulations, Kerry. Could you please come on stage? Right, thank you very much, Kerry. Now, the winner of the Recently Graduated Nurse of the Year is Shangying Tian. Would you like to come up to the stage, please, Shangying? Shangying joined Northbridge Medical Practice in April 2016 and has proven herself to be a responsible and keen learner. Her drive to achieve have seen her play an active role in the opening of a new associated medical practice in 2017. She's responsible for setting up the nursing component at the new clinic with 3 other nurses under her supervision. She's influential in taking a stand on significant general practice nursing issues and related issues in the practice. She's acted as the primary architect for protocols and manuals for the practice and assisting clinical outcomes of patients in the local community. And she's been instrumental in bridging the gap in her practice between doctors and nurses, and particularly impressed by how Shangying's pleasant demeanour adequately created an environment that is both beneficial for patient care and the running of the practice. That's a pretty fantastic achievement for someone who's a new grad. Well done. Well done. Okay. Now, our second award is the APNA Nurse of the Year, and this was a particularly tough competition. And so there are actually 3 people it came down to with this award. We have 2 finalists and an award winner. The first finalist is Margaret Crowley. Margaret is well known for her support of local organisations and service links and maintained to transport patients in and out of clinical settings. She's known to work tirelessly and ensuring that there is equal access to service for patients, consistency of treatment in her practice, and maintains a professional standard across healthcare settings. A standout for the assessors was Margaret's willingness to consistently go above and beyond requirements of her work role in order to build a more connected, informed and cohesive community. Under her leadership, Dubbo Sexual Health was the first New South Wales first in New South Wales to enter into partnership with the Gender Centre, providing support for transgender and gender diverse patients. A very proud accomplishment. Well done, Margaret. Our second finalist is Carolyn Gibson. Carolyn intentionally became a practice nurse to develop a framework and resources that provide other general practice nurses with tools to address cognitive impairment within its patient population. She's led the development of an innovative practice nurse model of dementia care at Ballarat Community Health General Practice. No similar practice model of care has been identified in Australia or international primary care. Carolyn's commitment to improving health outcomes for people living with dementia has involved many hours of promoting the role of nurses in dementia care. I might add that Carolyn is also one of our APNA Nurse Clinic pilot sites. So congratulations, and they're developing a lot of resources, so well done, Carolyn. Now, the winner of the APNA Nurse of the Year is Kathy Carrasco. Kathy is an extremely dedicated and experienced nurse. She has supervised and mentored other nurses, has implemented procedures and protocols for administering iron infusion, and been an advocate for the importance of the role of nurses can make to the community and to the medical community. Kathy goes beyond when it comes to helping her patients and families. She's doing home visits with GPs to attend to wound dressings and other concerns when patients are not able to get to the clinic. She's the first point of contact for many patients and families who need advice, particularly when dealing with elderly relatives. She's passionate about improving patient outcomes, and she initiated her clinic's participation in 2 health studies. Both these projects added considerably to her already heavy workload. Her belief that these studies may eventually benefit patients, and she was determined to be involved. She's frequently improving and building on her skills by attending educational sessions, and make sure she also has a role in implementing peer learning strategies with other nurses, general practitioners and administration staff. So congratulations, Kathy.
Yes, I'm right.
I'd like to invite Rosemary Bryant to the lectern and to say a few words. Come on up.
Thanks, Karen. Well, good morning, everyone. Lovely to be back with you all again this year. Had a great time last year in Hobart. Well, it is with great honour, obviously with great honour. Having an award named after one is pretty special, I must say. But so I'll be presenting this award today. It recognises someone who has made a substantial long-term contribution to advancing excellence in primary healthcare nursing. So the winner of this year's Rosemary Bryant Award is Chris Helms. Chris is a registered nurse. Unfortunately, he cannot be with us today, but I will read the citation. He's a registered nurse and endorsed nurse practitioner working in private general practice. He received his formal training as an adult and geriatric nurse practitioner from the University of Wisconsin, based in the United States. He immigrated to Australia in 2007 and has since served on several national and international committees to advance the role of primary healthcare nurses and nurse practitioners in Australia. Chris was an early member of the groundbreaking team that set up the nurse walk-in clinics in Canberra. And I was living in Canberra at the time and was very aware of some of the details of that, kindly provided to us through the Canberra Times. Quite often, I think at the instigation of some who shall remain nameless. You can guess who. These clinics provide free advice and treatment for people with minor illness and injury, an alternative that complements other services on offer. They have been incredibly popular, and that was one of the problems, of course, and see more than 36,000 patient presentations every year. They've since gone on to be, the pilot is now, or the nurse practitioner clinics are now part of the Canberra health system, or ACT, I should say. Chris recently completed his PhD in nursing at the Australian Catholic University. His research is embedded into a larger project called the Clever 2 study, which established and validated a specialty learning, clinical learning and teaching frameworks for Australian nurse practitioner students. Chris is a sought-after representative. He most recently represented primary health care nurses on the Healthcare Homes Implementation Committee. It is well known that APNA is a strong advocate for increasing the profile of nurses working in primary health care and for nurses working to their top of scope. And we heard our new CEO, Darren, talking about that this morning. It is very easy for us as an association to talk about this, but it is only from the examples set by our members that we can shine a light on this great work that nurses do and create real change for the policymakers and the healthcare system. In recognition of his efforts, we would like to publicly acknowledge Chris with this prestigious award. We have delivered the award to him in Canberra, and he has the following message to share with us. So we'd like the video to commence.
Hi everyone, I hope you're having a great conference. I just wanted to drop a quick line and say thank you very much for awarding me with this prestigious award. I briefly met Rosemary Bryant in her former role as the Commonwealth Chief Nursing and Midwifery Officer, and I am gobsmacked and quite humbled actually to be given this award, particularly because her contributions both nationally and internationally are really well regarded. So again, humbled, gobsmacked, wow. Firstly, I just want to say sorry for not showing up at this year's conference. Looks bad, I know, I'm sorry. But at the time that you're seeing this, I'm quite possibly on my 2,000th flu vaccination for the season. Yeah, so I know, I can almost hear the collective groans in the audience right now. I'm sure you can feel my pain. In fact, these are the Chupa Chup. This is one of 4 Chupa Chup containers that I've used to provide adults and students here at ANU for their flu vaccinations. So soon, I hope I'll have more time on my hands, and when I do, I hope to join you guys next year at next year's conference. I finished my doctoral studies recently, woohoo! And what I did was basically help establish a clinical learning and teaching framework for nurse practitioner students, irrespective of your specialty area. And interestingly enough, it does involve primary health care in the framework, and so hopefully, next year I'll be able to join you guys and discuss how my clinical learning and teaching framework can be integrated with the APNA Career and Education Framework, which will be really quite exciting because I don't know about you guys, but myself, there's a huge collective of people that are working very hard at actually trying to advance the nurse practitioner role within primary health care. We really need a viable, visible, and robust nurse practitioner workforce in primary health care. You guys know that we need more advanced nursing clinicians in primary health care, and I think it's where we're desperately needed. So it's a really exciting time right now because there's these policy levers that are being pulled that are really clearing the way for nursing at large and also the nurse practitioner role to advance within primary health care. It's such an exciting time. So hopefully, I'll be seeing you guys next year to discuss that. If you ever want to explore the nurse practitioner role, please feel free to email me at the address that you see below. And I hope you're all having a fabulous time at the conference and that your little goodie bags are brimming full of treats from the reps. I think that's probably my favorite part of going to conference, actually. Anyway, so again, thank you for the recognition afforded by this award. Again, gobsmacks. If you ever have any questions regarding the nurse practitioner role, or if you simply like to inherit one of these guys for a pot plant, please feel free to email me directly, and I'll do my best to point you in the right direction. Have a great conference, and again, thank you for the recognition afforded by this award. Thanks, guys. Bye.
As you can see, a very worthy recipient. Thank you.
Wow, what great awards. Please put your hands together for our brilliant award winners and finalists. Congratulations. Great to see all those amazing projects. We're sorry Chris couldn't make it. He's quite good looking, really, isn't he? Next year. And those chuppa chups, I just took my parents in to get their flu shot, and they get it from the GP, and then he'd had some weird thing happen with his fridge, and it lost temperature, so yeah, I know, they had to throw them all out, and they're still waiting for new ones, and then, and now he's trying to catch up, and then I think, why can't a nurse give them their flu shot? I don't know why they have to see the GP. Do they always have to see a GP? No. I've never seen a nurse in my parents' clinic and it's full, and sometimes you just want to go along and just sort of talk to someone about, my dad has trouble breathing, just what can we do? We don't need to see the GP all the time. So I'm going to go now and ask to be introduced to their nurse. Yeah, visible. I'd like to thank the people who present, Karen and Deb and Rosemary. Thank you very much for presenting the award. That was great. It gave it all the importance and gravitas that these awards deserve. I'd just like to say a few words to the winners of the awards. You might like to remember the wise words of the late, great Bob Hope. When he too was awarded by his peers, he said, "This award makes me feel humble, but I have the strength of character to get over it." Or the even wiser words by the late, great Jack Benny. He said, "I don't deserve this award, but I have arthritis, and I don't deserve that either."